And a heated debate unfolded in the National Assembly surrounding the Social Health Insurance Bill, with legislators from the opposition insisting that certain provisions within the bill will create opportunities for cartels to manipulate the sector.
The Social Health Insurance Bill, which aims to reform the healthcare system, faced intense scrutiny, some members raising concerns about the potential for the Social Health Insurance Fund to be exploited. Our health reporter Elizabeth Atieno with more.
The move to scrap NHIF and introduce the Primary Healthcare Fund, Social Health Insurance Fund and the Emergency Chronic and Critical Illness Fund has elicited mixed reactions from members of Parliament, as the four bills were on Wednesday tabled by Endebe's Member of Parliament Dr. Robert Pukose before Parliament for second reading.
Honourable members, I plead with you, we allow the NHIF team, the internal team, to process the payments and make the payment. That will help this country.
There is established already an entity. It is established in law under their very same bill. So this clause that establishes that bill should be the one to be allowed to take up the complaints.
Varying opinions emerged on the anticipated operations of the Social Health Insurance Fund if the bill passes in Parliament. According to the proposals, the Social Health Insurance Agency will be led by 12 members, including a Chief Executive Officer, prompting some legislators to question the qualifications of the CEO.
That it is unlawful and unconstitutional to say in a legislation that only lawyers can be anything.
That's right.
So, but I know. I'm just asking the chair.
No, you guys should allow Honorable TJ.
You know,
allow
you
him.
people, you are just something.
What I've actually done is to delete that requirement in clause 14 of the CEO to be an advocate of the High Court of Kenya. So I've done that.
Some legislators, especially those in the minority side, argue that the Social Health Insurance Fund will magnify corruption if a clear framework is not established about its operation.
Don't need this outsourced service. The other thing, Honourable Chair, and I like what the Majority Leader keeps on saying, he has always been saying the reason why we want to amend this law is to do away with the cartels already in the NHIF. I can tell you for sure, Honourable Chair, without any fear of contradiction, this is going to be the biggest cartel in town.
There are cartels that I know are already mobilizing and lobbying members. Therefore, Honourable Speaker, we must not fall prey.
The four bills tabled before Parliament for second reading include the Digital Health Bill, the Social Health Insurance Bill, the Primary Healthcare Bill, and the Facility Improvement Financing Bill. The bills have gone through amendments through the National Assembly's Departmental Committee on Health. If these bills pass and are enacted into law, then the National Health Insurance Fund will have 1 year to wind up operations before the implementation of the three proposed funds. Elizabeth Atieno, TV47, Nairobi.
Now, the county government